So, till now, we have discussed the introduction, what is the anesthesia and what is the local anesthesia and what are the ideal properties and pharmacokinetics, adverse drug reactions, and what are the routes of administration for the local anesthetics and the classification of the drugs. So, now we are going to discuss that what is the benzoic acid derivatives. So, let's discuss about the SAR of the benzoic acid derivative. So, most of the local anesthetics are the tertiary amines and which is available in the form of the salt. So its pK range is from 7.5 to 9. Any structural modification of the local anesthetic so that may cause changes in the pKa value. So if if the structure has been modified, if the local anesthetic drugs structure has been modified means the pKa value will be changes. And also the pronounced effect to reach the hypothetical reporter or the binding site. So, in this first one is lipophilic. So, I said no, that is the drug is a lipophilic and both hydrophilic in nature. So, the C here contains both lipophilic, hydrophilic. So, lipophilic means the substances can easily soluble in lipids, and hydrophilic means the substances easily soluble in the water. So lipophilic means the clinical useful local anesthetics of the class possess allyl radical. So that is attached directly to the carbonyl group and highly lipophilic in nature. So they appear to play an important role in binding of the local anesthetic to the channel receptor protein. So lipophilic, what it will do means it will help the drug to bind at the particular site of particular receptor. So it will helps to bind the drug at the particular receptors. So placement of the aryl group with the substituent. So if the aryl group is placed with the substituent, so it will increases the electron density of the carbonyl oxygen and it will enhances the activity. And the structural modification leads to change in the physical and the chemical properties. So if there is any changes in the structure means also there will be changes occur in its physical nature and also the chemical properties. So if the electron withdrawing means electron accepting group is present in the ortho para or maybe at both position, it will increases the local anesthetic means in the ortho position or maybe the para or maybe the both in these positions. If the electron withdrawing substituent is there means it will increase the local anesthetic property. So amino means procaine, butacaine, alkyl amino means tetracaine, alkoxyl means cyclomethacane groups can contribute to the electron density in the aromatic ring by both resonance and inductive effect. So it will increase the local anesthetic property. Any substituents with the enhanced Witter ion formation will be more potent. So meta position substituent decreases the activity. So if any of the changes occurs in the ortho position and the para position means it will increases its activity. But any of the substitutions occurs in the meta position means it will decreases the local anesthetic activity. So tetracaine is more potent than the procaine. So if we compare the tetracaine drug and procaine drug, the tetracaine is more potent than the procaine drug. So although the butyl group present it, it increases the lipid solubility and also the potential is partly due to the electron releasing property of the N-butyl group via inductive effect. So which tends to increase the formation of this bitter ion and formation of the electron withdrawn group such as chlorine ortho to the carbonyl pulls, it will pulls the electron density away from the carbonyl group. So, thus making it more susceptible from the nucleophilic attack by esters. So, next intermediate. In the procaine series, the anesthetic potency decreases in the following order that is sulfur, oxygen, carbon, and the nitrogen. So, if any of the modification will occur, it will affect the duration of the action and the toxicity. So, in the intermediate, see here, this is the intermediate. So, in the intermediate part, if any of the changes has been occur means it will affect the duration of the action and also the toxicity. So, in general amines, XN are more resistant to the metabolic hydrolysis, and if it is X is replaced with the oxys hydrolysis, then the esters oxygen. So thioesters may cause the dermatitis. So if in the X position N is there, means it is more resistance towards the metabolic hydrolysis when we compare with the oxygen group. So if sulfur is there, means it will cause a skin problems, that is dermatitis. So placement of the small alkyl groups around the ester group or the amide function also hinder the hydrolysis and increases the duration of action. So next, hydrophilic portion. The amino alkyl is not necessary for the local anesthetic, but it is needed for to form the water soluble salt. So basically the local anesthetic, it does not require the alkyl amino alkyl, but the drug has to be soluble in the water. So for that purpose, amino alkyl group is necessary. So tertiary amines are more useful agents, and secondary amines have the longer duration of the action, but they have the nerve irritation. So primary amines are not active and also cause the irritation. So the tertiary amines may be diethylamino, piperidine. So these are the some which comes under the tertiary amines, which leads to the product that exhibits same degree of the activity. So the more hydrophilic Morphiliano group usually leads to the diminished potency. So in general, the local anesthetic should have increased lipid solubility and lower the pKa value, which leads to the rapid onset and lower toxicity. Means the drug should have the more lipid solubility and lower pKa value for the better on activity of the drug, and also it will reduce as the whatever the toxicity of the drugs are there. So this is the SAR of the benzoic acid derivatives. So let's see, first drug is cocaine. So it is the natural alkaloid which is obtained from the coca tree, that is the erythroxylone coca. See, erythroxylone coca, this is the main plant. From that plant we get the cocaine. So cocaine is methyl benzoyl ester of ignonine. So it was first used local anesthetic to be discovered. So this is the first local anesthesia to be discovered, but it is too toxic in nature when we given in the parenteral route, but still being employed topically to produce anesthesia. So if we given through the parenteral route, means it is more toxic, but we can give by using the topical, means by applying on the skin. So this is the structure of the cocaine. If you see the IUPAC name, methyl 3-benzoyl oxy 8-methyl 8-azabicyclone octane 2-carboxylate. See here, methyl 3-benzoyl oxy 8-methyl 8-azabicyclone octane 2-carboxylate. If you see the structure here, one 6-membered ring and one 8-membered ring, and here nitrogen and methyl, and here carboxylate, and here one of the carboxylate is present. See here, methyl, and here in 3, this is the benzoyl oxy 8-methyl 8-aza means nitrogen bicyclone. See here one of the one cycle and here another cycle, means bicyclone. So this is a 8-membered ring. Octane 2 carboxylate is there. See, methyl, here one of the methyl 3 benzoyl oxy 8-methyl 8-aza bicyclone octane 2 carboxylate. So this is the structure and IUPAC name. And the properties, it is a colorless to white crystalline in nature, or crystals or powder form. It is slightly soluble in water and soluble in volatile oils, ethyl ether, benzene, chloroform, and the toluene. Very slightly soluble in ethanol, and it is insoluble in glycerin and petroleum products. So pharmacokinetics, it is the topical and nasal means nose. So it is a topical and nasal route of administration, and it is metabolized to the benzoyl benzoyl and agonine methyl ester, which are both excreted in the urine. So, in the presence of alcohol, a further metabolite is formed and it is more toxic than the cocaine itself. So, this is the topical and the nasal route of administration, and it is metabolized to the these are some of the metabolites and which are excreted in the urine. So, if the drug is in the presence of the alcohol, it will produce another metabolite, that is coca-ethylene. See here, coca-ethylene is formed in the presence of the alcohol. It is more toxic when we compare with the cocaine. An adverse drug reaction center, it will affect the heart, like a raise of the blood pressure and myocardial infarction, allergic reactions, and also if we take in the large dose, heavy dose means sexual dysfunction, anorexia means loss of appetite, tremors, emotional disturbances we can able to see. So drug dependence is one of the serious side effect of the cocaine. So if we take the more amount of the drug frequently means we can able to depend upon the drug. So we cannot able to leave the coke by taking of the drug when we habituated to this drug. This is the main effect. So users is no more longer produced for the parental route. So this drug has the side effects when we take in through the parental route. So this drug has been given to the topical anesthesia. So this is mainly used as a topical anesthesia. So next one is xylocaine, is also known as cycline and osmocaine. So this drug is also known as cycline and osmocaine. So it is a short-acting local anesthetic that it will act by the inhibition of the sodium channel. So it will act mainly by inhibiting the sodium channel, and the patient's experience on the overdose. So if xylocaine is taken, the overdose means some of the person has been experienced with the headache, tinnitus, numbness, and tingling around the mouth, tongue, and also the convulsions, inability to breathe, decrease the heart function. And also this drug has been discontinued in the US market because of the side effects like headache, tinnitus, and also it will affect the heart, convulsions, inability to breathe. Next, structure. See, this is the structure of the hexylocaine. If we see the IUPAC name, that is 1-cyclohexylamino propane 2-YL benzoate. See here, 1-cyclohexylamino propane 2-YL benzoate. So if you see the structure, this is the 2 6-membered ring, and here 1, 2, 3. 3 carbon atoms means propane is there, and here amino is attached. See here, 1 cyclo, this is the cyclic structure with 6-membered ring. So that is the cyclohexyl amino, and here propane 1, 2, 3. 3 carbon atoms are there, propane. In the second position, it is attached to the benzoate structure. So this is the structure of the benzoate. So here 2-YL benzoate, 1-cyclohexyl amino propane 2-YL benzoate. So properties are, it is a white powder and it is soluble in water and chloroform. Next, pharmacokinetics, it is the topical and the nasal route of administration, and it is metabolized in the liver and excreted through the urine. Adverse drug reactions are headache, tinnitus, numbness around the mouth, tongue, and also the inability to breathe, decrease the heart function, and also swelling of the lips, tongues, and the chest pain, dizziness, drowsiness, convulsion, nausea, vomiting, anxiety, and convulsions. Next, therapeutic uses, it is a benzoic acid ester. So it is a local anesthetic that has been used for the surface anesthesia for the mucosa membranes. So it will produce the transist block of the nerve conduction by interfering with the sodium channel. So it is mainly used as a surface anesthesia by blocking the nerve conduction. So it will block the nerve conduction by interfering with the sodium channels. So next one is meprilicane. So meprilicane. So this is the structure. If you see the IUPAC name, 2-methyl, 2-propylamino, propyl benzoate. See, 2-methyl, 2-propylamino, propyl benzoate. See, if you see the structure here, this is the benzoate, 6-member ring with COO. So it is a benzoate. 1, 2, 3. 3 carbon atoms means propyl. In the second position, methyl group is there, and this is the amino. And 1, 2, 3. 3 carbon atoms means propane. See here, 2 methyl, 2 propyl amino, propyl benzoate. See here, 2 methyl, 2 propyl amino, propyl benzoate. So this is the structure and IUPAC name of this drug. And the properties are, it is the oily in nature and insoluble in water and soluble in alcohol, ether, acetone and oils. So pharmacokinetics, it is the intravenous and subcutaneous route of administration, metabolized in the liver and eliminated through the kidneys. Adverse drug reactions are difficulty in breathing, allergic conditions, chest pain, irregular heart rate, drowsiness, feeling of the anxiety, convulsions, nausea, and the vomiting. Uses, it is used as the local anesthetics. Next, cyclomethacane. So this is the structure and this is the IUPAC name. 3,2-methyl piperidine 1-YL propyl 4-cyclohexyloxybenzoate. See here, 3,2-methyl piperidine 1-YL propyl 4-cyclohexyloxybenzoate. See, if you see the structure here, 1, 2, 3 means propane, and here one of the 6-member ring, here one 6-member ring, and here the piperidine structure is attached. In the second position, methyl group is there. So 1, 2, 3. In 3, in second position methyl, 2-methyl. This is the piperidine. So first position of the piperidine is attached to the propyl. So 1-YL, and this is the propyl, and this is the 4-cyclohexyloxy. So this is 6-member ring in the cyclic form. So cyclohexyl, here one of the oxygen is there, and this is the structure of the benzoate. See, 3,2-methyl piperidine 1-YL 4-cyclohexyloxybenzoate. So this is the structure and IUPAC name. And the properties are, it is a white crystalline powder, soluble in water and chloroform. So pharmacokinetics are, it is oral route of administration and metabolized in the liver, eliminated through the kidneys. And adverse drug reactions are difficulty in breathing, we will feel the pain in the chest, and tachycardia means raising of the blood pressure, vasoconstriction, anxiety, and also the blocking of the sodium channels, cardiotoxicity by blocking the sodium channels. So it is also affect the heart. And uses, it is used to relieve the pain from the damaged skin, mucous membrane of the rectum, vagina, and the urinary bladder. So next one is piperocaine. This is the structure. And if you see the IUPAC name, 3,2-methyl piperidine 1-YL propyl benzoate. 3,2-methyl piperidine 1-YL propyl benzoate. If you see the structure here, this is the piperidine. In the second position, methyl group, and this is the propane, and this is the benzoate structure. So 3,2-methyl piperidine propane benzoate. See here, 3. In third position of the propane, it is the piperidine is attached. So 3,2-methyl piperidine propane benzoate. Properties are, it is a white odorless crystalline powder, and it is freely soluble in water, alcohol and chloroform. So Pharmacokinetics, it is ophthalmic means eye and topical route of administration, and it is metabolized in the plasma. Adverse drug reactions are blurred vision means can't able to see properly, redness of the clear part of the eye. So it is mainly, so we can also administer it to the ophthalmic means eye. So the side effects may also occur on the eye. So means redness of the eye, sensitivity to the light means can't able to see the light properly, tearing and bloody eye and burning, itching, redness and irritation of the eye, changes in the vision. So uses, it is a local anesthetic and it is a ester mainly used for the sodium channel blocker. So this is the drug mainly responsible for sodium channel blocker, and also it will inhibit the dopamine. It is known as the alpha 1 proteinase inhibitor and used in the form of the hydrochloride as a local or the spinal anesthetic, and also it is used in the dental anesthesia means teeth. So these are the drugs till now we have discussed, which comes under the amino benzoic acid. Next, so benzoic acid derivatives. Next one is amino benzoic acid derivatives. Let's see what are the drugs involved in the amino benzoic acid derivative. So in this first one is benzocaine. So this is the synthetic nitrogenous derivative of the para-amino benzoic acid. So PABA means para-amino benzoic acid, and it is poorly soluble in water, and it is available as the ointments, gel, sprays and liquids. So this is the structure, and if you see the IUPAC name, ethyl 4-amino benzoate. See, ethyl 4-amino benzoate. So this is the structure of the benzoate, and this is the ethyl and this is the amino. In the fourth position of the benzoate, amino group is there. Ethyl 4-amino benzoate. So this is the structure and IUPAC name. So properties are, it is a white crystalline or colorless in nature, and it is sparingly soluble in water, and it is more soluble in dilute acids and very slightly soluble in chloroform, ethane and ethyl ether. So mechanism of action, it will bind to the sodium channels and reversibly it will stabilize the neuronal membrane, which decreases the permeability to the sodium ion. So the depolarization of the neuronal membrane is inhibited, thereby blocking the initiation and conduction of the nerve impulse. So synthesis. The starting material is the toluene. The six-membered ring with methyl is the toluene. When it undergoes the nitration in presence of the nitric acid or sulfuric acid, so we will get the para-nitrotoluene. So in the para position, the nitrogen or nitro group is attached. So it is para-nitrotoluene. When it undergoes the oxidation process in presence of potassium permanganate, KMnO4 is the potassium permanganate, we will get para-nitrobenzoic acid. Means here in place of the methyl, the benzoic acid is attached. So here when it undergoes the decondensation process, means removing of the water molecule in presence of the sulfuric acid or ethanol. So C2H5OH is the ethanol. We will get para-nitroethyl benzoate. So here one of the hydrogen and here one of the OH is eliminated from the ethanol. See here from the ethanol one of the hydro OH, and here from the benzoic acid derivative, here one of the hydrogen is eliminated in the form of the water, and remaining C2H5 means ethyl is attached here to get para-nitro. This is the ethyl benzoate. So in presence of the hydrochloric acid, when it undergoes the reduction. So reduction means removing of the oxygen and adding of the hydrogen atom. So here in place of the nitro group, in the nitro group, one of the oxygen is eliminated. In place of the oxygen, hydrogen atom is attached. So this is the synthesis of the benzocaine. I will explain it again. See, the starting material is toluene. When it undergoes the nitration in presence of the nitric acid or sulfuric acid. So here in the para position, the nitro group is attached. So it is para-nitrotoluene. When it undergoes oxidation process in presence of potassium permanganate, so the para-nitrobenzoic acid is attached, will come. So in place of the methyl here, the benzoic acid COOH is attached. So when it undergoes a reaction with ethanol, the water molecule is eliminated. So here OH from the ethanol and one of the hydrogen from the para-nitrobenzoic acid is eliminated in the form of water to get para-nitroethyl benzoate. So when it undergoes a reduction process, means removing of the oxygen, adding of the hydrogen atom, the hydrogen is attached to get the benzocaine drug. So this is the synthesis of the benzocaine. Next, pharmacokinetics. It is the dental means teeth, topical oral route of administration, and it is metabolized into the three compounds by acylation and hydrolysis process. So it and benzocaine and its acylated metabolites are eliminated across the grill, while the more polar deethylated and deacetylated metabolites are excreted at the slower rate, primarily in the urine. So it is a dental, topical, and oral route of administration, and it undergoes a metabolism process by acylation and hydrolysis process, and it is eliminated through the urine. So adverse drug reactions are burning, itching, stinging, and skin redness, dry white flakes, headache, weakness, dizziness, fast heart rate, breathing problems, and changing of this color, skin color, changing of the skin color, and burning sensation, sensitivity when the where the medicine has been applied, swelling, and the redness. So these are the adverse drug reactions. So uses topical, it is used to reduce the pain or discomfort caused by the minor skin irritation, sunburns, teeth pain, rectal irritation or the vaginal irritation, and sore throat. So it is mainly used as a topical for the reduce the pain. What are the pains we will feel when the sunburn, pain, paining of the teeth, and vagina irritation, rectal irritation, and sore throat, skin irritation. So in that cases, we can use it as a topical form. So it is also used to numb the skin or the surface inside the mouth, nose, throat, vagina, or the rectum. So it is used for performing the minor surgeries in the eye. So not only to reduce the pain in the different body parts, but also it is used in the surgery of the eye, in the minor surgery. So next, butanol. So this is the structure. If you see the IUPAC name, butyl 4-amino benzoate. Butyl 4-amino benzoate. So this is the benzoate structure. 1, 2, 3, 4. 4 carbon atoms means butyl. In the fourth position, amino group is there. So that is the butyl 4-amino benzoate. So this is the structure and IUPAC name. It is the white, odorless, crystalline, and does not have any taste, and it is soluble in water, mildly soluble in water, and soluble in alcohol, ether, chloroform, and fixed oils, and it slowly hydrolyzes when boiled with water. So pharmacokinetics, it is a dental and topical route of administration. The metabolic path of the drug follows the same pattern of the other local anesthetic. Means whatever the metabolic pathways are there for the other drugs of the local anesthetic, so this drug is also have the same metabolic pathway, and it is the metabolic path found in the plasma processing the deposition in the urine. And adverse drug reactions are skin rashes, means it is this drug we are taking through the topical route, so skin rashes, itching, allergic reactions, redness of the skin, irritation of the mouth, means these are taken through the dental route all means. So we can also face the irritation of the mouth, skin inflammation, drowsiness, headache, tremors, irregular heart rate, and low blood pressure. So uses, it is mainly used as a local anesthetic, and it is indicated for the treatment of chronic pain due to the long duration effect, and also it is indicated as a surface anesthesia for the skin mucous membrane for the relief of the pain. associated with the anorectal disorders. The next one is procaine. So it is the first synthetic local anesthesia. So procaine is the first synthetic local anesthesia to be introduced, and it is the nitrogenous derivatives of para-amino benzoic acid. Para-amino benzoic acid, and which is freely soluble in water, and it is not used as a surface anesthesia. Uh, it is ineffective when topically applied. So it has a slower onset of action than the lidocaine, and its duration of action is too short. So this is the structure of procaine. An IUPAC name is 2-diethyl amino ethyl 4-amino benzoate. 2-diethyl amino ethyl 4-amino benzoates. This is the structure. See here, this is amino and benzoate, and this is the 1-2. 2 carbon atoms means ethyl, diethyl amino. 2 diethyl amino ethyl 4-amino benzoate. See here, 2 diethyl amino ethyl benzo 4-amino benzoate. So this is the structure and IUPAC name. Properties are, it is a white odorless crystalline powder, and it is soluble in water, alcohol, ethyl ether, and benzene, and it is slightly soluble in chloroform and insoluble in ethanol. Let's see what is the mechanism of action. So it will mainly act by inhibiting the sodium influx through the voltage gated sodium channels in the neuronal cell membrane of peripheral nerves. So when the influx of the sodium is interrupted, an action potential cannot raise. So signal conduction is inhibited. The receptor site is to locate at the inner cytoplasmic portion of the sodium channel. So procaine has shown to bind, or it will antagonize the N-methyl D-aspartate receptor, as well as the nicotinic acetylcholine receptors and the serotonin receptor ion channel complex. So it is main mechanism of action. It will inhibit the function of the sodium channels. Nothing but inhibition of the sodium channels is the mechanism of action. So synthesis, from here we can synthesize this drug by using any of the methods. So 3 methods are there. First method is preparation from the 4-amino benzoic acid. So starting material is 4-amino benzoic acid. See here, in the fourth position, 1, 2, 3, 4. See here, 1, 2, 3, 4. In fourth position, amine group is there. So 4-amino benzoic acid. When it is reacted with 2-diethyl amino ethanol. See here, 1, 2. In second position, diethyl amino ethanol. When it undergoes the condensation process in presence of sulfuric acid, we will get the procaine. So here one of the hydrogen, and here one of the hydroxyl group is eliminated. Hydrogen from the 4-amino benzoic acid and hydroxyl group from the diethyl amino ethanol is eliminated in the form of water. So remaining atom is attached here to form the procaine. See here, 4-amino benzoic acid. When it is reacted with diethyl amino ethanol, undergoes a condensation process in presence of sulfuric acid. So here one of the hydrogen atom from 4-amino benzoic acid, and here hydroxyl group from diethyl amino ethanol is eliminated. So remaining is attached here to form the procaine. So next, preparation from the 2-chloroethyl para-amino benzoate. So starting material is 2-chloroethyl para-amino benzoate. When it is reacted with diethyl amino, so if we apply some of the pressure, what will happen here? One of the chlorine atom from the 2-chloroethyl para-amino benzoate, and here one of the hydrogen from diethyl amino is eliminated in the form of hydrochloric acid, and remaining is attached here to form the procaine. See here, 2-chloro para amino benzoate when it is reacted with with ethyl amine. So here one of the chlorine atom from the 2-chloroethyl para-aminobenzoate and one of the hydrogen from the diethyl amino is eliminated in the form of hydrochloric acid and remaining is attached here to get the procane. Next, third method is preparation from the 4-nitrobenzoic acid. The starting material is 4-nitrobenzoic acid. When it undergoes the chlorination process, so the para-nitrobenzoyl chloride is formed. When it undergoes the condensation process in presence of N, N diethylamino ethanol, we can get the intermediate product. When it undergoes the reduction, the procane is formed. So this is the synthesis of the procane. The three methods are there. First one is preparation from the para-4-aminobenzoic acid. Next one is from the 2-chloroethyl para-aminobenzoate. Next one is 4-nitrobenzoic acid. So next pharmacokinetics, it is the vasodilator. It requires the addition of the vasodilators like epinephrine retards its synthetic absorption. So procane is poorly absorbed from the mucous membrane. It is rapidly hydrolyzed and plasma esterized to its metabolites. So PABA means para-aminobenzoic acid and diethylamino ethanol. So where the PABA inhibits the action of the sulfonamides. The cerebrospinal fluid contains the little or no esterase. Hence, when the procane is given through this route, it remains active until it gets absorbed into the systemic circulation. So, it is this drug is directly given to the cerebrospinal fluid for it to show the activity of the drug. So, adverse drug reactions are diarrhea and peeling of the skin changes, dizziness, joint pain, fast heart rate, numbness, redness of the arms or the legs, confusion, depression, and also the chest pain, problems in the vision and the speech, and also fever, chills, dizziness, muscle pain, rapid breathing or the rapid heart rate, uncontrolled muscle movement, and problem with the balance or the walking means the person cannot able to balance himself or cannot able to walk properly, and also the sore throat, flu symptoms, etc. So, and slow heart rate, weak pulse, fainting, slow breathing, vaginal itching, and blurred vision, headache, dizziness. So these are some of the side effects we can able to see for the procane drug. And uses it is used for the infiltration, peripheral nerve block, anesthesia, and also the spinal anesthesia. So infiltration anesthesia and also peripheral nerve block anesthesia and spinal anesthesia. And it is also used for the central nerve block anesthesia, and also it is used as an anti-arrhythmic drug. And the procane penicillin has the antibacterial activity. Means this is not only used as a local anesthetic, but also it is used as the anti-arrhythmic drug, and also it is used as the antibacterial activity. Next, butyrkine. This is the structure, and if you see the IUPAC name 3 dibutylamino propyl 4 amino benzoate. See here 3 dibutylamino propyl 4 amino benzoate. If you see the structure here, this is the benzoate structure. In fourth position amino, and this is the 3 carbon atoms means propyl, and 4 carbon atoms are there means butyl. See here 3 dibutyl amino propane 4 amino benzoate. 3 dibutyl amino propyl 4 amino benzoate. And properties, it is a white crystalline and it is soluble in water. So used pharmacokinetics, it is a topical and the parental route of administration, and it is metabolized in the liver, eliminated through the kidneys. Adverse drug reactions are sleepiness and muscle twitching, ringing in the ears, change in the vision, low blood pressure, irregular heart rate, and heart problems, and also fatigue, vertigo, tinnitus, low blood plasma concentration, restlessness, anxiety, dizziness, seizures, coma, hypotension, and arrhythmias, bradycardia means reducing of the blood pressure, heart block, and cardiac arrest. Uses, it is used by the dentist to minimize the pain during the tooth extract. So it is mainly used by the dentist during the tooth treatment, and also used to relieve the back pain surgeries in the spinal anesthesia and central nerve block anesthesia. Next, tetracaine. This is the structure of the tetracaine, and IUPAC name is 2-dimethylamino ethyl 4-butyl amino benzoate. See here, 2-dimethylamino ethyl 4-butyl amino benzoate. So this is the structure. If you see the structure here, this is the phenyl benzoate. See here, this is the benzoate. In the fourth position, 1, 2, 3, 4. 4 carbon atoms are there, means butyl, and this is the amino. And here 1, 2 means ethyl. For this ethyl in the second position, dimethyl. 2 methyl groups are there, dimethyl amino. See here, 2 dimethyl amino ethyl 4 butyl amino benzoate. See here, 2-dimethyl amino 4, this is the ethyl 4-butyl amino benzoate. So this is the structure and IUPAC name. And the properties are, it is the white crystalline powder, and it is a hygroscopic in nature, means it can easily absorb the moisture from the atmosphere when it is exposed to the nature, and also soluble in water, freely soluble in water. And pharmacokinetics, it is a ophthalmic means eye, topical and intraspinal oral route of administration. So it is the ester type local anesthetic. Tetra can get hydrolyzed by the plasma and liver esterized through the para-amino benzoic acid, which is highly allergic in nature. So the metabolism is usually slow, which makes it high toxic. So it is ophthalmic, topical, intraspinal and oral route of administration. And when it undergoes the metabolism in the liver, it will turn into the PABA. So it is more allergic in nature. Adverse drug reactions are blurred vision, means can't able to see properly. Redness of the clear part of the eye, means the eyes become red. Tearing, sensitivity to the light, bloody eye, burning, itching, redness and irritation of the eye, change in the vision, nausea, vomiting, irregular heart rate, drowsiness, dizziness, swelling and irritation of the skin, breathing problems, sleep disorders and loss of hearing. So uses, it is used for the induction of the spinal anesthesia. So it is mainly used as a spinal anesthesia, and it is also topically applied on the nose, eyes, throat and respiratory passages. Next drug is benzoxinate, and this is the structure, and IUPAC name is 2-diethylamino ethyl 4-amino 3-butoxybenzoate. See here, 2-diethylamino ethyl 4-amino 3-butoxybenzoate. So if you see the structure, this is the benzoate structure. 1, 2, 3. 4 carbon atoms means butyl. So here one of the oxygen, so butoxy, and here 1, 2. 2 carbon atoms means ethyl, and here diethyl amino. See here, 2-diethyl amino. This is the ethyl. 4-amino 3-butoxybenzoate. See here, 2-diethyl amino ethyl 4-amino 3-butoxybenzoate. Properties and pharmacokinetics are, it is a white crystalline and soluble in water, and it is an ophthalmic route of administration. So adverse drug reactions are redness of the eye irritation, conjunctival redness, dermatitis on the fingertips, allergic reactions, blurred vision, etc. And it is mainly used as the local anesthetic in the eye surgery. So next one is propoxycine. So this is the structure of the propoxycine. And IUPAC name is 2-diethylamino ethyl 4-amino 2-propoxybenzoate. See here 2-diethylamino ethyl 4-amino 2-propoxybenzoate. So this is the structure of the benzoate. In the second position, this is the propoxy. So 3 carbon atoms are there, propoxy, and here 1 2 means ethyl diethylamino, 2 diethylamino ethyl 4 amino 2 propoxybenzoate. See here 2 diethylamino ethyl 4-amino 2-propoxybenzoate. So this is the structure and IUPAC name. Pharmacokinetics, it is a topical route of administration, and this undergoes some metabolized in the liver and excreted through the urine. Adverse drug reactions are blurred vision, sensitivity to the light, tearing, vision problems, and allergic reaction. It is mainly used as the infiltration and nerve block anesthesia. So these are the drugs which comes under the para-amino benzoic acid. So till now what we have discussed, that amino benzoic acid derivatives and para-amino benzoic acid derivatives.